Lymphatic filariasis. Contents: brief overview of the disease, which includes number of the disease incidence locally, nationwide, or worldwide, characteristics and classification of the helminth. Host or host range, pathogenesis or modes of infection and transmission. Symptoms, prevention, control, and treatment of the disease, recommendation or conclusion.
Lymphatic filariasis, commonly known as elephantiasis, is neglected tropical disease. Infection occurs when filarial parasites are transmitted to humans through mosquitoes. Infection is usually acquired in childhood, causing hidden damage to the lymphatic system. The global baseline estimate of people affected by lymphatic filariasis was over 25 million men with hydrocele and over 15 million people with lymphedema. At least 36 million people remain with the chronic disease manifestation. Eliminating lymphatic filariasis can prevent unnecessary suffering and contribute to the reduction of poverty. Lymphatic filariasis, commonly known as elephantiasis, is a painful and profoundly disfiguring disease. It is caused by infection with parasites classified as nematodes of the family Filarioidea that are transmitted through the bites of infected mosquito. Mosquitoes transmitted larvae are deposited on the skin from where they can enter the body. The larvae then migrate to the lymphatic vessels where they develop into adult sperms and then continuing a cycle of transmission.
Host: filarial worm, any of a group of parasitic worms of the family Filariidae, phylum Nematoda, that usually require two hosts, an arthropod, the intermediate host, and the vertebrate, the primary host, to complete the life cycle. The larval phase occurs within the body of a biting insect.
Pathogenesis or modes of infection and transmission. Lymphatic filariasis is caused by infection with parasites classified as nematodes or roundworms. Worms can live for approximately 6 to 8 years and during their lifetime produce millions of microfilariae or immature larvae that circulates the blood. Mosquitoes are infected with microfilariae by ingesting blood when biting infected host. Microfilariae mature with infected larvae within the mosquito. When infected mosquitoes bite people, mature parasites larvae are deposited on the skin from where they can enter the body. The larvae then migrate to the lymphatic vessels where they develop into adult worms, thus continuing a cycle of transmission.
Filariasis infection involves asymptomatic, acute, and chronic conditions. The majority of infections are asymptomatic, showing no external signs of infection while contributing to the transmission of the parasites. This asymptomatic infection still causes damage to the lymphatic system and the kidneys and alter the body's immune system.
Prevention and control. Avoiding mosquito bites is the best form of prevention. The mosquitoes that carry the microscopic worms usually bite between the hours of dusk and dawn. If you live in or travel to an area with lymphatic filariasis, sleep under a mosquito net, wear long sleeves and trousers, use mosquito repellents on exposed skin between dusk and dawn. What is a treatment for lymphatic filariasis? People infected with adult worms can take a yearly dose of medicine called diethylcarbamazine or DSC that kills the microscopic worms circulating in the blood. While this drug does not kill all of the adult worms, it does prevent infected people from giving the disease to someone else.
Conclusion and recommendation. The best way to prevent lymphatic filariasis is to avoid mosquito bites. To lessen the number of mosquitoes in our place, we should keep our environment clean. If you noticed having symptoms of the helminths, make sure to contact your doctor. Thank you for watching.